Good evening, everyone, and welcome to our Learn with LOPA Virtual Education program. Our first speaker this morning will be Dr. Kimiyo Williams. She is a resident of Terrebonne Parish and has been for 16 years. Focus is educating her patients on health eating habits, which is the framework of her practice. She's a member of the Delta Research and Education Foundation, Health That Matters. She's a pediatrician also specializing on additional education for adults. Dr. Kimiyo Williams, we welcome you to our virtual learning education training today.
Thank you so much. Can I begin?
I would like everyone to ensure your microphones are on mute. Thank you. You may proceed, Dr. Williams.
Thank you all. Thank the LOPA group for having me tonight for this webinar. Thank you, Ms. Cheryl, for the invitation and for your entire organization doing great work. This work is so needed in our community because of the chronic diseases that plague us in the community. So I was asked to speak tonight about hypertension and diabetes, and I want to just have this disclaimer. Everything that I'm presenting tonight is based on peer reviews from Up to Date, which is a medical resource, and it reviews several different articles on these topics. So I just want to put that out there. I'm going to go ahead and start, and I'm talking tonight about hypertension and diabetes on tonight. So the global prevalence of hypertension is high, and among non-pregnant adults in the United States, treatment for hypertension is the most common reason for office visits and for the use of chronic prescription medication. These findings were published in an article in Hypertension in 2015, in a CDC report in 2014, and in an article in January of 2018 in Circulation. In addition, roughly half of hypertensive individuals do not have adequate blood pressure control. There are stages and there are different stages and classifications of hypertension. So the normal blood pressure, the systolic blood pressure would be less than 120, and diastolic is less than 80. For staging system, elevated blood pressure, your systolic would be 120 to 129, and diastolic would be less than 80. For stage 1 hypertension, systolic blood pressure would be 130 to 139, and diastolic would be 80 to 89. Stage 2, systolic at least 140, or diastolic at least 90. So these two are stage 1 and stage 2. So how do we make the diagnosis of hypertension? So in individual patients, making a diagnosis of hypertension requires an integration of multiple blood pressure readings. We have to use appropriate technique and also use measurements made outside of the usual office setting. So these are some guidelines. Screening at a minimum, the frequency of screening should be as follows. Adults with normal blood pressure should have reassessments of their blood pressure every year. Adults should be screened at least semi-annually if they have risk factors for hypertension, such as obesity, or if they were previously measured having a systolic blood pressure of 120 to 129. No. So a patient who presents with hypertensive urgency or emergency, those patients are diagnosed with hypertension. So they would have a systolic blood pressure of greater than 180 and a diastolic blood pressure of 120. That patient is diagnosed with hypertension. A patient who presents with an initial screening blood pressure of 16 greater or equal to 160 over greater than or equal to 100, and who has known target in organ damage also has a diagnosis of hypertension. Hypertension is diagnosed if the mean home blood pressure, when measured with appropriate technique and with a device that has been validated in the office, is greater than or equal to 130 over greater than or equal to 80. So, what is the pathogenesis of hypertension? What is hypertension all about? So if we look at the blood vessels, maintenance of arterial blood pressure is necessary for organ perfusion. So we have to get oxygen and blood to our organs to perfuse them. So the pathogenesis of primary hypertension, or formerly called essential hypertension, is poorly understood, but is most likely the result of numerous genetic and environmental factors that have multiple confounding effects on cardiovascular and the renal structure and function. So what are some risk factors that contribute to the development of hypertension? So age is one risk factor that contributes to hypertension. Older age, advanced age can be associated with increased blood pressure. And it also causes more so elevated systolic blood pressures and it increases the incidence of. So you see more older people with hypertension. Obesity is another risk factor. Obesity and weight gain are major risk factors for hypertension, and also causes an increase in family history. Hypertension is about twice as common in subjects who have one or two hypertensive parents, and multiple studies have suggested that genetic factors account for approximately 30% of variations in blood pressure based on different populations. Race is another risk factor. Hypertension tends to be more common and be more severe and occur earlier in life, associated with and is associated with greater target organ damage in Blacks. High sodium is a risk factor. Excess sodium intake increases the risk of hypertension. Sodium restriction lowers blood pressure in those with high sodium intake. Excessive alcohol consumption is another risk factor. Alcohol contributes to the development of hypertension, and physical inactivity also increases the risk of hypertension. So what are some complications as it relates to hypertension? Left ventricular hypertrophy is one complication, which that is an enlargement of the left ventricle of your heart. That's the ventricle that pumps the blood out to your body. That ventricle becomes hypertrophy. Ischemic stroke. Another complication is intracranial hemorrhage, ischemic heart disease, including myocardial infarction, which is a heart attack, and chronic kidney disease and end-stage renal disease are complications of hypertension. So what are some treatments as it relates to hypertension? And I'm sure that we all have heard about this and talked about this either with your family members or with your provider, healthcare provider. but lifestyle modifications should be prescribed for all patients with elevated blood pressures or hypertension. Not all patients diagnosed with hypertension require pharmacological therapy, but medication therapy is another treatment for hypertension. So, actually went to this side too quickly. So, what do we talk about when we talk about lifestyle modification? So, a couple things to keep in mind include dietary salt restriction, weight loss. It's been found that weight loss in overweight and obese individuals can lead to significant fall in and a significant fall in blood pressure, independent of exercise. So even if you are not exercising, but if you continue to lose weight and modify your diet and lose weight, there's been studies have shown that there has been a decrease and a decline in those patients' blood pressure. Another thing you want to look at as far as lifestyle is the DASH diet, the dietary approaches to stop hypertension. And this diet encourages high vegetables, fruits, low fat, whole grains, poultry, fish, nuts, and low on sweets, low on sugar, and sugary beverages, and low on red meat. So this diet actually has been shown to help to lower your blood pressure as well. So another lifestyle modification that's been studied and shown and have proven to lower blood pressure on an average of 4 to 6 for systolic and 3 for diastolic blood pressure is exercise. So it is encouraged that we exercise, especially if you have a diagnosis of hypertension. And that exercise is recommended approximately, you want to at least exercise 3 to 5 days a week, 30 minutes a day, at least aerobic exercise. Decrease and limit alcohol intake also has been beneficial as a lifestyle modification as far as treatment for hypertension. And also, as we said earlier, modifying your diet has a big impact on lifestyle modification treatment for hypertension. And we won't go into the pharmacologic therapy for hypertension. I think that's a little bit in depth, but the decision to initiate drug therapy is individualized based on the patient's underlying conditions, and it's in collaboration with the provider and the patient. But that is a little more in depth. But those are based individually on what medications to choose for what patients. Certain populations, certain medications work better for that population as opposed to others. So all of those things come into play when deciding what drug therapy to start. So we'll talk about prevention. So a variety of dietary modifications are beneficial in the treatment of hypertension, and all of those things we've discussed already. But just to talk a little bit about prevention, it's been found that changing a diet and including a diet rich in fruits and vegetables, nuts, low fat, dairy products, low in products low in sugar. Those things tend to help to decrease blood pressure. And I actually have a personal testimony to share with you all. I actually was diagnosed with hypertension in my 30s, and I was taking two medications for it, and I did green smoothie. I did this green smoothie cleanse, and I started to incorporate fruits and vegetables via smoothies in my diet. So I would do those like twice a day. Initially, I did them 3 times a day, and then I would do them twice a day with organic fruits and vegetables. And I was able to completely come off all of my medication. So I can attest, this is just a personal testimony. It's not anything that I've done a study on, but I just want to say that I can attest to the fact that changing your diet does help, and eating fruits and vegetables. And if you can purchase organic, I would recommend those as well. So that was just a personal testimony that I wanted to share. And that's actually one of the major reasons why I've transitioned. And I say transition, but my career has moved more into advocacy. And I've always been an educator for my patients, but I'm more of an advocate now in this area, because it's so important that we learn what helps the population to improve our healthcare outcomes, and research has a big part in that. So I just wanted to put that in. So then now we'll talk a little bit about diabetes, which we all know diabetes and hypertension kind of run together as far as when you think about the complications as it affects the end organ disease, especially renal disease. So as far as diabetes is concerned, we have type 1 diabetes, which affects approximately 5 to 10% of adults. We also, in type 1 diabetes, is characterized by an autoimmune destruction of the pancreatic beta cells, and this leads to an absolute insulin deficiency. So this type of diabetes is something that it has a different mechanism of action. It's more of an autoimmune disease. So type 2 diabetes is by far more common in adults. Greater than 90% of people with diabetes who are adults have type 2 diabetes. So what is type 2 diabetes? So type 2 diabetes is characterized by hyperglycemia, usually due to a progressive loss of insulin secretion from the beta cells superimposed on a background of insulin resistance, resulting in relative insulin deficiency. So type 1 and type 2 end up with insulin deficiency, but it's from a different mechanism. So the majority of patients are asymptomatic when they present with hyperglycemia. Most of the time is noted on a routine lab evaluation, and that prompts further testing to make the diagnosis. So as far as diagnosis is concerned, if you're symptomatic, usually the symptoms include increased thirst, increased urination, weight loss, blurred vision. If you have these symptoms and your random blood glucose is greater than 200 milligrams per deciliter or higher, then that is a diagnosis of diabetes. So you can also be asymptomatic as well. And these are the criteria for diagnosis for someone asymptomatic. So we usually look at fasting blood glucose, either a 2-hour plasma glucose during a 75-gram oral glucose tolerance test, or looking at your hemoglobin A1C. So if your fasting plasma glucose is greater than 126, and this is repeated, you are diagnosed with diabetes type 2. If your 2-hour plasma glucose is greater than 200, or if your hemoglobin A1C is greater or equal to 6.5%. So what are some factors that play in diabetes? So family history, of course, is a factor. Most diabetics have a strong family history of diabetes. 2 to 3-fold increase, there's a 2 to 3-fold increased risk of developing diabetes if there's a first-degree family history of diabetes. So that's very important, and that leads me to encourage people to know their family history. Make sure your provider knows your family history, because those things will prompt the provider to do more in-depth testing if they know that you have a family history of diabetes. So ethnicity is also a factor. African Americans, Asians, Hispanics have a higher risk of diabetes as well. And as said, with hypertension, obesity also is a risk of diabetes. Your lifestyle can also contribute to development of diabetes. Insulin resistance develops over time based on your activity, your diet, smoking, alcohol consumption. All of those things that contribute to your lifestyle can contribute and increase your risk of insulin resistance and developing diabetes. So, what about the morbidity of diabetes as well as hypertension? So with diabetes, you can get microvascular and macrovascular disease, which impacts your blood vessels, causes atherosclerosis and retinopathy, neuropathy, nephropathy. All of those apathies affect the eyes, the kidneys, and the nervous system. Those things can, if untreated and uncontrolled, can lead to organ damage. So it's very important that these diseases, both hypertension and diabetes, are treated and kept under control. Even more so, it's always important to keep them under control. But with COVID-19 here, and we're still in the first round of COVID-19, and we have that second wave coming through that's been predicted by all of the public health officials and medical providers, that we have these chronic illnesses under control, because those are the people with chronic diseases that are not controlled have poor outcomes as it relates to COVID and overall as it relates to health. So it's very important to understand these diseases and to keep regular appointments to keep these diseases under control. And also, I just want to add in, lupus is another serious disorder, autoimmune disorder that affects the kidneys and can lead to organ damage and a need for organ transplant. So I have that testimony because my sister has lupus, and she actually did receive a kidney transplant. So we have a victory celebration there. So she's doing well. But I thank you so much for giving me this opportunity to share diabetes and hypertension with you all.
Dr. Kimiyo Williams, we thank you so much